Begin the webinar, I'd like to acknowledge the traditional custodians of country throughout Australia and the connections to land, sea and community. We pay our respect to the elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander peoples today.
Good morning, everyone, or good afternoon, depending on what part of the country you're in. Welcome to our webinar on mastering effective digital signage in hospitals and healthcare. My name is Rachel Wolfe. I'm the Chief Customer Officer here at Five Faces, and I'm joined by the amazing Kellyanne. Kellyanne, did you want to introduce yourself?
Hi, everyone. My name's Kellyanne. As Rachel said, I'm the Senior Marketing Coordinator here at Five Faces. Excited to be joining today.
Thanks, Kel. So before we kick off, just a little bit of housekeeping. If you have any questions, please feel free to use the Q&A box that should be visible on the bottom of your screen. At the end of the webinar, we do have some time put aside to respond to as many of those questions as we can. If we do run out of time, we will follow up with you in person. Also, at two different intervals during the webinar, Kelly is going to pop up a little poll. We would really appreciate your feedback in that poll. All responses are anonymous. And also at the end of the webinar, there'll be a short survey, really simple for you to complete, but provides us with a lot of valuable feedback. Also, in addition, this webinar is being recorded and we will share a copy with everyone who has been registered for the webinar. So today we're going to talk through a few different things. We're talking largely around digital signage in a hospital and healthcare environment. So why and how would you use digital signage? Any use cases and examples of how digital signage can actually support the patient journey throughout their day of visit or their admission, whatever that might be. An overview of our digital signage product and different types of digital signage. And Kelly's also going to share some use cases from current clients using digital signage in a hospital and healthcare environment. Thanks, Kel.
Wonderful. Thanks, Rach.
So let's start right back at the beginning, Kel.
Yeah.
When we're talking about digital signage, it might seem like a really obvious and simple question, but when we're talking about today, what do we mean by digital signage?
Yeah, so it is, I think, a good starting point just to sort of preface what we're going to be talking about throughout the webinar. So essentially what we understand digital signage as is it's a modern way to display information on screens, such as your TVs or monitors in an environment. So instead of seeing, your traditional printed signs that you might see in a hospital or a clinic or a facility, it's being able to project your digital signage content and messaging, anything from your announcements or even directory information, even videos, onto those screens. So the best part about it is that it can be updated instantly from your device, and it makes it easy to keep information fresh and relevant without having to replace or print new signs, which is often very time consuming from what we hear from clients. Yeah.
And Kel, I think we've all walked through a hospital where we've seen a notice board with, posters and printouts stuck up that probably aren't on brand for the hospital as well. So a really great way for them to control the imagery that's used, their branding, and the design.
Yeah.
So, you know what it is and like why would it be needed, or so what are the benefits for a healthcare environment?
Yeah, so I think the term that we like to use here at Five Faces is creating that phygital experience. So blending both, digital innovation with the physical environment of a hospital or the healthcare facility. So it's bridging those two environments to create that sort of seamless experience. But the reason why we would use digital signage in a healthcare environment is because often it's a very dynamic environment. So there's a lot of different audiences and people, different types of people going through a hospital or healthcare environment. So digital signage is a great way to capture those people at different points throughout the hospital and engage them using digital screens around the hospital. So things like digital directories, which is really important to help reduce, patients who are navigating throughout the hospital to like your passive content. So that might be in your waiting rooms or different clinics, and that just helps to improve that wait experience. So it just provides that extra support for patients, visitors, different types of people throughout the hospital and healthcare environment.
Excellent.
Did you want to add anything there, Rach?
No, that's okay. We might go to the next slide because I think that flows really nicely into who we can reach through digital signage. So, Kel, as you know, but a lot of the people joining us may not know, is my background was working in a large public hospital environment for more than 20 years. So it's a very busy environment. It's dynamic, and what I mean by that is the clinics and types of patients coming in can change from, I was going to say day to day, but almost hour by hour. The people moving through the hospital change from day to day. The staff coming through, contractors, visitors, any sort of executives coming through. So not only that, the organization actually changes from day to day. I don't think I can think of another environment that is as dynamic as healthcare.
Yeah.
So it's really hard to communicate in mass with stakeholders because the range of stakeholders is so broad. So I think for me, having digital signage, we can actually reach all those audiences at some point. So that can be external audiences like patients and visitors and the public coming through, and the internal audience. So, our clinicians, paramedics coming through, volunteers, and all levels of staff. And I think what I don't like constantly referring back to the COVID example, but it was such a challenging time that we did need to communicate with a large group of people. And I think what it taught us is we do need to react really quickly to changing environments. And we need centralized ways to do that. So by able to broadcast out a messaging to every screen about changes to visitors, who is allowed entry to the hospital, what's the current status, being able to send that out centrally through one method and one channel of communication. Obviously, it's not the whole message, but it's one way to share that out.
Exactly. And I think we've definitely seen all the posters that get put up around, when those restrictions might change in hospitals, but that obviously takes time. So a digital signage solution can obviously support that and streamline that whole process.
Yeah, exactly.
Um,
I'll
I
get you
think,
to. Oh.
yeah,
So
sorry.
I was just sorry, Kel. I was just going to ask. So we've got some, examples here of the types of messages that we can share, noting that the audience is so broad and the types of people we need to reach are so broad. Can you talk us through a couple of these examples, please?
Yep. So as you can see here, these are just some of the types of messages that we have seen clients use when using digital signage. So everything from promoting key messages. So I think when you think of digital signage, I think your head automatically goes to, that patient-facing or outward-facing messaging, but even your key messages for staff as well is really important. So having even digital displays in staff areas to promote, OH&S and policies, even staff initiatives in their world of things as well, and even reminders about, updating. Rach, you would probably know a little bit more, but what kind of messaging would you have seen?
Yeah, so things like any mandatory training and competencies coming up,
Yeah.
any opportunities for education, and even some down to, displaying in the tea room, happy birthday, Kellyanne,
Yeah,
or some social events is a really nice way to reach those staff.
exactly. And I think another important type of message to call out is that ED experience. So digital signage can also support, patients coming into ED. Often you're feeling quite anxious or, frustrated because you might have not been able to find the ED as easy as you'd like, or wait times as well is often a typical friction point. So I think having digital signage to support that experience, maybe you might have updates on wait times or more of your passive content or like infotainment to entertain patients in that sort of environment. And then, of course, I particularly find digital signage important for your called patients as well. So your culturally and linguistically diverse patients that are coming through those environments. So digital signage is a great way to be able to translate any messaging into, other languages to support that community as well.
The other example that I really like there too, Kel, is broadcasting emergency warnings. So we're working with a client now where we can integrate with their building management or building early warning system. And if there is a fire alarm or an evacuation going off, that will actually integrate and display on our digital signage solution. So going back on your culturally and linguistically diverse patients, we can actually, take over the screens to let them know to evacuate, provide an arrow directing them to the nearest exit, which is also really important, I think, if people are hearing impaired, they won't often hear the alarms going off. So that
Exactly.
visual is great.
Yeah, exactly. I might just launch our first poll here, Rach. So
Yeah.
I will launch that now for everyone who's online with us. So I'll just pop that out. So if you are with us today, if you can just pop your responses in there.
So we have those two questions there. How does your organisation currently use digital signage, if it does at all? And what's the biggest challenge facing with implementing digital signage? And as I said earlier, all these responses are anonymous, so please be honest. And then, Kel, did you want to share the results with us?
Just end that one now.
So wayfinding and navigation, 50%, that is an important one too. We know these hospitals are often, rabbit warrens. It's quite difficult to find your way around, particularly, a lot of people walking into a large hospital. It's quite overwhelming and you can be quite anxious.
Yeah.
So that definitely supports that. And biggest challenge, content management. Yeah, so that's a great one as well. I think it is a challenge, but digital signage also helps to control that content management, streamline it, make sure it's on brand and approved by the right people, rather than stuff sometimes going rogue and printing posters.
Yeah, I can definitely relate to that in marketing comms here too. Stop sharing that one and we'll just jump back into press.
Thanks, Kel. So on the next slide, we've got some types of digital signage and use cases. So Kel, I'll just get you to talk through, what these are in effect and how they can be used.
Yeah, so these are sort of the typical use cases that we see digital signage used in. So everything from more of that passive content and promoting those key messages. So it might be out to staff, visitors, any consumers that are in the environment, even through to your retail or pharmacy supplies in the hospital as well. They also can use digital signage to, push through any promotions or campaigns that they're running. And then I think we've touched on already those emergency warnings and putting out that messaging for cold consumers as well. I think an interesting one, Rach, that you've sort of been working on recently is also patient journey boards.
Yeah, the patient journey boards is an interesting one, and it works really well with like the queue calling. So if you have a lot of patients needing to move through a particular clinic or admissions, being able to overlay the queue calling to display the patient's anonymized ticket number when they're ready to be seen by a clinician or to head to a waiting room works really well. Because if there is no clinic or no ticket being called at the moment, you can still have that really lovely content rather than a blank screen. So you kind of get a 2-for-1 there. You can have your digital signage and
Yeah,
then the nice calling display.
yeah, exactly. And then other sort of use cases that are quite popular in the healthcare space are, of course, your digital directories as well. So instead of having maybe your traditional directory boards that you might have to manually update, you can have those in a digital version. And wayfinding as well. So from our poll, that's obviously a key use case there too. So anything from passive wayfinding information or interactive displays as well. And then this can also be extended out to, having it on the patient or visitor's phone. So taking that information from the digital display, maybe scanning a QR code, so then it's easy for them to navigate from the display throughout the hospital. Yeah.
Yeah.
I'll move.
So the next slide, Kel, we'll just talk through how digital signage can support the patient journey on the day of service or appointment while they're there. And you see we have everything from pre-arrival through to checkout there. But directories and wayfinding can certainly support the patient when they walk through the door. As we said, it's often an overwhelming environment, a large facility, so they can. Oh, she's skipping ahead. No, that's so the wayfinding and directories, how to find their clinic or their particular specialist room or ward is very helpful. The digital displays, as we mentioned, for the wait experience, so that can be really nice having their infotainment or distraction there as patients are waiting, and overlaying that with calling displays as well. So patients can look to the screen to see when they're ready to be seen, what's the approximate wait time. So, we often find patients are okay to wait and they expect to wait, but, would like to be communicated with on how long the anticipated wait time is. So potentially they can actually go to the cafeteria and have a coffee and still have that calling display visible there.
Yeah. Thanks, Rach.
So, Kel, you work a lot with our digital signage software. You're the guru of it. So, can you just talk us through how does it work from a day to day?
Yeah. So I think the easiest way to sort of understand how it works is in these three sort of categories that you can see here. So from a day-to-day perspective, once you've sort of got all the hardware and players set up, once you've got that plugged and ready to go, you have the content side of things. So that is where you would upload your content, and this content can be sort of in any type of form. So it can be images, so JPEGs, PNG, it can be a video, it can even be a landing page through like a URL or a HTML link, and of course videos, so through MP4. And then with that content, once it's uploaded, you would go into the scheduling. So that's where you would schedule your campaign out to your screens, and you can schedule it according to, different timing. So it might be weekdays, you only want the content to play, or versus the weekend, you might have different content playing. And then clinic schedules as well. I'm sure you've seen, Rach, there's different clinics running at different times.
Yeah, correct. And I think that's important that, in an emergency department, it's 24/7, 7 days a week. So, it's important that they can have that content displaying all the time, but different clinics running on different days might actually need to communicate different information. And, an example is, there might be an allergy clinic that runs on Tuesday and Wednesday, and they may want to publish a slide that says, just a reminder not to bring food and drink into the clinic. We don't need that displayed every day. So it can actually be cycled and scheduled to display on those days, or even within that scheduled time.
Yeah. And then there's the hardware part of it. So our digital signage works with media players. So those players, once we've configured those for clients, those are easily plugged in and ready to play the content. So that can also be grouped into, you might have all of your staff-facing screens, as I mentioned earlier, grouped into one player group is what we call them. And you might be able to push like messaging out to that group, or you can do individual players and individual screens in the hospital too.
And Kel, for those who may not know, a media player is just like a mini PC, like a little box that gets mounted behind the screen, that enables us to push content to.
Yeah.
Right. So I know we've got some slides coming up, Kel, with some snips of demos. So just being conscious of time, I'm, no spoiler alert, but we have some recordings. But can you just talk us through some of the key functionality and features here for our digital signage solution?
Yeah, thanks, Rach. So I think a couple of the things you can see here we've already touched on already. So scheduling that content in advance. So being able to pre-create those campaigns ahead of time and schedule them according to, when you want that messaging to display on the screens. It's instant, I guess, is one of the most obvious things. It's once you publish, it takes a few minutes to update the display, and your content is out and on the screens. Some of the other things Rach touched on, the calling display, so improving that patient flow and helping queues to flow nicely. Directories we touched on. And I think another important one there is that role-based access control, and also single sign-on. So that's sort of more from a cybersecurity point of view. You can assign different users different permissions within the software, which you can do. And then also zoning content. So that's the example you can see on the screen here, how we've sectioned the screen at the top there into 3 different zones. So you've got your calling display on the right-hand side. You might have some video content, or, you might broadcast a channel or something like that in that main section of the screen. And then you can have your nice branding and, brand messages at the bottom.
And I think, Kel, that the role-based access controls and the ability to make those unlimited, like instant changes, and zoning the content make it really suitable for large enterprise organizations. So if there are multiple facilities within a health district or health service, then it makes it easy for them to push that out and control it without having to run around to screens with USBs.
Exactly. Yeah.
Yeah.
Which is very time consuming. So I think we'll jump into a little bit of the solution here, Rach. So it's just a very quick overview of what our digital signage solution looks like. So just running through here the different modules that make up our solution. So you've got your campaigns, delegates, your media, and your streams here. So that's where you would upload files. There's a list of the players or your player groups and those timing groups as well. So just jumping back to the campaign scheduler here, this gives you an overview of all your campaigns in a consolidated sort of view. You can view it in that timeline view or a list view as well, which you'll be able to see. And then you can search through all of your campaigns using that field there or filters as well. So I'm just flicking through the different views there, list view, and then just looking back at the timeline view. And then I am just showing here how easy it is to upload files. So it's in just a few clicks, you're able to upload those files straight from your device. So here I'm just uploading a few different images. And you can see a preview of the files you're about to upload. So those are uploaded in just a few seconds. And then you get a nice preview here as well of the content. So once my content is uploaded, I would go into the campaign scheduler and start creating my campaign. So in this example, I'm just creating a campaign for a women's and babies clinic. You can set a start date and an end date for your campaign. You can prioritize it in case you have multiple campaigns running at once and you want to make this the #1 priority. You can set that timing group so it plays for 24 hours. And then here I've selected all of the women's and babies players. So I've made a group at multiple locations and I've put them into one group. So it's nice and easy for me to push out the content to all of the screens at once. Here I can preview my files again that I'm adding to the campaign. This can also be viewed in a list view in case you've already uploaded files and you want to go back and sort through those. Then you can also preview here. It's a nice, beautiful interface. You can obviously configure the colors as well based on your branding. And here I can also set the duration and specific start and end dates for certain files too. So I can see that one was created. In this next example, I believe I'm creating a calling display. So that's something that we just talked through, Rach, where you can section a screen with that calling display on maybe the right-hand side. And that's using our zoning feature. So zoning allows you to have multiple streams of content running at once. Which is a really handy feature, while patients are waiting for them to be able to get updates on them being called to the clinician or having that entertainment running at the same time for patients who are waiting. So here I'm just showing the zoning and how easy it is to add those zones. So you can add up to 5 different zones to your screen. We see more zones more in like a retail space where they might want to have lots of different messaging on the screens at once.
So Kel, that orange zone that you added down the right-hand side, that would be an example of where the calling display tickets would appear.
Exactly, yeah. And this is just showing how easy it is to configure those different sections of the screen. And then here I'm just showing, so zone 1, I'm adding my files to that. So I might add a video file there, some nice ambient content to play in the main sort of section of the screen. And then assigning some other content to the other sections. So that calling
Kel, I can also see their IPTV. So where you've added the content in the main screen, we can actually use IPTV, so a TV channel or streaming for patients to watch.
I am conscious of time, so I might just skip ahead. But yeah, I think that gives everyone a pretty good idea of how easy it is to use.
Thanks, Kelly. And then the other one we just wanted to touch on was using that calming content. So we've talked a lot about, distraction, but the research on using calming content in a healthcare environment is that water scenes are particularly a distraction and calming on patients and can reduce anxiety and improve the waiting experience. For example, an ED. We can actually work with other providers to plug in their calming content, or you can create your own. But study on the effects of visual art featuring scenes like we're seeing, the tranquil scenes of nature in 2 EDs in Texas actually found that this reduced fidgeting, pacing, and actually front desk inquiries and aggressive behavior. So it actually can improve the staff experience too. Happier patients and visitors, is often happier staff. So I think that this looks great. It's a lovely feature.
I think it's important to note as well, you might have families, so the entertainment and that content, side of content, is also important. You might have, parents waiting with young children in certain clinics. So having that sort of information and entertainment sort of blended together in one is an effective way of using digital signage.
So Kel, could you just talk us through quickly some of our success stories on, who has used our digital signage and how they've used it?
Yeah, so I think the most recent example we have seen is a well-established private hospital in the Darling Downs region. Recently have transformed some of their manual traditional sort of directory boards into our digital directories. So they were able to replace these and they've seen the digital directory boards a lot more time efficient for them. So instead of having to manually update those old directory boards, which were also costly for them to be updating all the time, they have found the digital directories really beneficial because they can have a updated list of all of their clinicians and different sites in the hospital on the directories. And it's nice and easy for them to update. And then we also work with Bupa, so across their health insurance and visa services as well. So they've done some interesting things with digital signage too. So you can see in that example there, they have these beautiful sort of window displays using the digital signage, and they have that beautiful ambient content displayed on those screens. So it's a nice way to experience for their clients coming through their retail stores. And then visa services, they get a lot of different clients across different backgrounds. So they've been able to translate their digital signage and service messaging into different languages as well. So that was really interesting to see. And then Terry White as well, I guess from like a retail sort of pharmacy perspective, they've got some beautiful double-sided displays in their stores too, just to engage, customers either outside the store or inside the store, because they're those beautiful double-sided displays. So that's just a few of the sort of clients we're working with.
Thanks, Kel. We do have some questions, but I might you've got a poll to put up,
Yes,
another quick poll. So,
thank you for the reminder.
okay, we might just pop that up quickly before
Yep.
people have to drop off. But just a reminder, we will share a recording of this.
Yep, so just launch that one there.
So what outcome would you prioritize using digital signage? And does your hospital have a dedicated team for managing digital signage content? So it'd be interesting to see if you do, who manages it. Mostly we find, comms and marketing are great for controlling that messaging and the branding.
Yeah.
Have a look at the results, Cal. So what outcome would you prioritize? Enhancing patient experience. That's what we like to hear here. And then does your hospital have a dedicated team for digital signage? Yes, comms and marketing. I just need to make that window a little bit bigger. And we don't currently have digital signage.
57%.
Excellent. We do have some questions, so I won't take too long touching on this, but we have found building a business case for digital signage can be challenging. It's often not seen as a large priority. So communicating any cost savings or benefits, return on investment is really important. We have found not having USBs being replaced in screens, which is actually resource intensive, exactly. And printing costs as well. And on the printing costs, if your organization does have sustainability targets, digital signage can definitely help to support that as well. And translating key messages to linguistically diverse patients, particularly, so multilingual content is great as well.
Yeah.
I do just want to, because we have had 3 interesting questions from Stuart. So thank you, Stuart. One was around how do you manage issues with infection control around like the kiosks? So touchscreen directories and our check-in kiosks post-COVID, lots of facilities have to remove these. So I think we are, taking a step sort of back to pre-COVID where people are tending to go back to the kiosk, but we can actually overlay any screens with antimicrobial film, which does reduce the risk of cross-infection by, I think it's something like 95%. I can find out exactly for you. But on top of that, we also do support BYOD or mobile experience for the patient. So they can check in on their mobile device, and that might be because they've received an invitation to check in on their device, or they can scan a QR code and use their own device to check in. I think instead of standing in front of a kiosk, that's probably what I would choose, but a lot of people still do tend to that kiosk is a physical structure and it draws you in.
Yeah.
So that's how we can support that. Striking a balance between static traditional signage versus digital signage is an interesting one. So, when we think of the facility name or things that aren't going to change, like the number, the floor levels, particularly we're probably not looking to, if we go up to level 5 and there's a lovely big, number 5 in acrylic printed on a wall, that's not something that's likely to change. It's a lovely feature to the architecture and the environment. Exactly. So you do have to look at what do you need to control, what is likely to change, versus what is static, and how does it add to the environment around? Is digital going to improve it or take away? Because we also need to consider not being too digital and tech heavy in some of these environments, and where digital is required, making sure that the experience is nice and the content is well displayed. And on that last question, so Stuart has asked, how does digital signage respond to the needs of people with disabilities, for example, braille or tactile? So it is a challenging issue with digital signage. It can't necessarily, as the screen changes, obviously display and braille, which is why we also support, a lot of BYOD or patients using their own phone to access content, because they will, have a screen reader. So everything that we develop, all our software is Web Content Accessibility Guidelines 2.1 AA at a minimum. So we ensure that everything is compatible with the screen reader, that all the error messaging is available to be read out to the patient. Any images have that alt text. So where we can't support all patients or all people with disabilities, we try to think of an alternative method, and most of the time that is using their own device as well.
Yeah.
So I hope that helped, Stuart. Thank you. I think we're sort of out of time, Kel, but I will just thank you so much for your time. It was great to hear an insight from someone in marketing, and not necessarily someone, someone who uses the system, and not necessarily someone who designs the software. So I think it was great having your insights.
Thank you so much for having me. It's been, I think when I think of from a marketing point of view, everything sort of takes time to learn and understand. So if anyone has any more questions or they'd like some more information about the solution or any of our other solutions, feel free to reach out to us. But yeah, thank you so much for having me, Rach.
Thanks, Kel. Thanks, everyone. Have a great day.
Thank you.